for 6 months at least, to be on the safer side, 6 months, if you try, if you don't get a positive report, you should consult a gynecologist, a sexologist, or someone to talk to, a consultant who can actually take care of both the issues. Fertility is talked about.
Yes,
you definitely go towards the gynecologist and get all the female tests done.
yes, sir.
You never go to a sexologist, you never go to a men's health expert and get the husband checked for that reason. People are getting evolved, like the wives, the girlfriends, the partners are coming along with the patient, telling their problems. So things have evolved. Yes, we are getting towards a better tomorrow now.
Hey, Dr. Sankalp, thank you so much for doing this with us.
Yeah, sure, please.
A brief introduction about me. My name is N. Jamir. Friends call me Jamie. I work as a content creator with Subhak Health Tech. And ever since our product got launched at Shark Tank India, we've been talking about what infertility is, trying to destigmatize infertility as much as possible in India. And therefore, before we start, as an introduction, could you kindly introduce yourself, your name, your designation, where you are from?
Hello, I am Dr. Sankalp Jain. I am head IVF division for Dr. A.K. Jain's IVF clinic in Lucknow. So we basically have a fertility legacy in Lucknow itself, and we are catering pan-India patients like globally also since like more than 97 years now. And this thing, the legacy has been since like from my grandfather, great grandfather, and my father. So now we are up with, since like 8 years, we are into the IVF division along with sexology and along with infertility. So we have started our IVF thing.
Right. Thank you so much, Doctor, for that introduction. So with over close to 100 years of experience, then I'm talking to a wealth of knowledge, and I'm so happy about this opportunity.
Yeah.
Yeah, so I will not ask you what infertility is and all. I will straight away jump to, over the course of these months, dealing with a lot of doctors, talking with numerous patients, I've seen that women seem to bear the brunt of stigma more. What are your thoughts on that?
So basically, I have also received an award in 2017 for this campaign, which I have floated on social media for the same thing. Like the social stigma is so much ingrained in our society. Then when infertility is talked about, you definitely go towards the gynecologist and get all the female tests done.
Yes, sir.
You never go to a sexologist, you never go to a men's health expert and get the husband checked for that reason. So talking about this stigma, talking about the male ego that we are able to see in our society, the chauvinism that we are able to see in the society, it is somewhere changing now. That's a very good thing. And where Suhag, this thing, the IUI setup that you guys have, this thing has also made it more easy for people who are seeking for results for fertility and seeking for conceiving help and everything. So stigma has obviously been there, yes, but we are trying to like eradicate the stigma and make it towards more male dependent.
Exactly, sir. So you're seeing a progress as in terms of.
Definitely yes. Definitely yes. People are accompanying right now the wife of the patient, because I regularly, my legacy has been into the men's health, always into men's health, male infertility, male problems, the male sexual disorders. So when people in the past came with the helmets on and everything so that nobody sees if I'm able to, like, I'm going to get myself tested. Now people are getting evolved, like the wives, the girlfriends, the partners are coming along with the patient, telling their problems. So things have evolved. Yes, we are getting towards a better tomorrow now.
That's encouraging.
Yeah.
The thing is, though, I think stigma starts with family. Agree?
Yes, definitely.
How do we
respond? It does start with the family, but when I am able to see most of the infertility cases here, when reported to our OPD, when reported to our hospital, are most of our undiagnosed cases. When people are able to see, I am having this thing, the semen reports, the semen analysis is perfect, the AMH level of the female is perfect, the follicular stimulating hormones, LH, everything is perfect. But why they are not able to conceive the baby? It is because of the male sexual dysfunction that is ignored, that is not addressed upon, that should be addressed at a level. How, like, whenever in a family, if a female, if a girl child, if anyone has a problem, they rush to a gynecologist very easily. When male problem is concerned, they don't even talk about in the family, they don't even seek help of any qualified expert, they try to get medicines all over the places. That's what it is, landing them into the infertile, like the population. So this thing has to more, we have to more like get evolved with it and accept what problem we are having, and moreover we can actually go towards a better tomorrow now.
And it's totally okay to have some sort of sexual dysfunction. It's treatable.
Definitely, it's totally treatable.
Exactly, sir. So you mentioned about male sexual dysfunction being ignored. What are these dysfunction that we're talking about today?
So primarily early ejaculation, the erectile dysfunction, the premature ejaculation, all these things are evolving right now. 78%, like the recent Times of India study I was seeing, 78% of the male population is going through some or the other problem. It may be sexual dysfunction, it may be infection, it may be related to their reproductive organ. But similar end that I'm able to see here, that these people are not accepting it. Yes, sir, I am having this problem. When diagnosed with all the nerve conduction velocity test and all the ultrasounds and everything, then they are accepting, yes, sir, I think at some point I may have this problem. Then also acceptance is not there. So similar, I need to tell people, like similarly, you are having heart blockages at the age of 20 years, 22 years, 25 years. People are getting heart attacks, people are getting cardiac arrest. So similar, and the blockages is also like hindering the reproductive organ. Similar, and the heart is a pumping organ. So similar, and male reproductive organ is also a pumping organ. The blood flows and goes through it. So blockages may affect the sexual health of a male partner. When diagnosed, it can also be the early diagnosis of any cardiac problem also. So ED can actually, agar when diagnosed with ED, it can actually be the early diagnosis of any cardiac problem also. So I have read all the case studies. I'm able to see people are going towards those areas from where we are like into research. My father is into research since like 37 years now. With the same blockages part, nobody was accepting it, but now people are accepting, our cardiologists are accepting it. So we are happy. The better the results.
That is one interesting take. Erectile dysfunction is an early symptom of, okay,
cardiac problems. Yeah.
Yes. All right. I wanted to come back to the IUI thing you mentioned. Now, a lot of people know IVF and they seem to jump into IVF consultation. However, not many people are aware of IUI, and I feel it's a less intrusive treatment. What do you say?
I think IVF versus IUI, if we talk about versus part, IUI is many times better than IVF because it requires less needle involvement. It requires less trauma. It requires less amount of pressure on the females that people are getting, because all the things that happen is to a female. All the visits, all the conceiving issues, everything, all the dietary requirements, everything is for the female. So when IUI is concerned, when in case of tubal blockages, when in case of like low AMH levels, and primarily or secondarily in the level of where male partner is not sexually appropriate at a level to get those semens inside the womb. Okay, so these are ejaculatory dysfunctions, that are the ejaculatory pressure is low. So because of that, IUI is the best way that we can treat. So it requires very less amount of time, less pressure on the female. So I find IUI a better option and a very cheap option also.
Exactly, sir. And I was talking to an IVF warrior, and she says that the side effect of IVF was enormous on her body. She developed lumps on her breasts. That's a very scary thought.
Sorry?
That's a very scary thought. The side
That's a
effect.
really sweet one. That's what I said. All the things that IVF has, all the things that any treatment regarding females have, everything has to like on the female. Everything is on the female. So when we talk about side effects, we definitely have hormonal because we induce them with hormones. We induce them with progesterone, everything. So inducing anything and actually making the cycle somewhere a very on a very higher level, those levels of the hormones of the females can go higher. It can always cause the lumps, it can always cause the fat deposition around the areas, and that female has to handle. But when you talk about IUIs, it's a very simple process, it's a very non-complicated process, and it's a cheap process. We should actually go towards IUIs.
Yes, definitely, sir. Now, one of the top surprising reason for subfertility in India is non-consummation of marriage.
Yeah.
Very surprising from the land of Kama Sutra. What could be the
Yes. Look, everyone has a different view on this, right? Everyone has a different view on this. But when people come to my OPD, most of the cases that are reported for divorces here in India, where people are not accepting each other, is somewhere related to their intimate life. It's somewhere related to their fertility life. It's somewhere related to their actually like how much the each other people all the people are the couples are sinking in their lives. So everyone is working right now, everyone has their pressure, so people are actually getting towards late pregnancies. They have their own decision, they have somewhere matlab, things are different. Everyone has a different point of view for this.
Yes, sir. Which brings me to the next question.
Yeah.
Differences in libido in a couple causes a lot of marriages to break and unhappy marriages. How does this impact fertility?
So what I really give my interviews to all the channels and everything, I definitely talk about libido. I definitely talk about their intimacy levels, because if the two people in the marriage are not able to sync their hearts out, right? If the two people in the marriage are not able to get their satisfaction level to the level that each of the like couple is comfortable in it. Some people may be like comfortable in a 5 minutes of a intimate life. Some people may get orgasms and everything in 1 hour. So it depends person to person. People have to come up. People have to actually tell the consultant that I am not like he's not getting at that level that I want for him. So when you talk about these things now, okay, how much the sexual life of a person, how much the intimacy level of the person is actually plays a very big role in a marriage. Plays a very vast role in a marriage, because if you don't have a coordination with your spouse, if you don't have a coordination that in that what you say, the inner sense wala coordination, that sixth sense, okay, you saw my eye, I saw your eye, we know what to do next. That level of coordination should be there for a couple. And if this is lacking, so somewhere fertility is just a work for them, it's not a pleasure.
Yes.
So when some things are done half-heartedly, when some things are done in a pressure, in a society pressure, moreover, so these things, but infertility and the sexual induced infertility actually comes into the role, and that's where we play the role for the people to make their life happy.
That's amazing. Leading up straight to the next question: when should a couple decide to visit a sexologist like yourself?
A couple, after like what the book says, after you try for 3 months minimum, and it can go up to 6 months also, it can go up to 1 year also, it depends on the age of the couple. So for 6 months at least, to be on the safer side, 6 months, if you try, if you don't get a positive report, you should consult a gynecologist, a sexologist, or someone to talk to, a consultant who can actually take care of both the issues. Like here in Dr. A.K. Jain's clinic, we have been dealing into men's health, sexology, the sexual impotence, sexual dysfunctions since like 97 years. Since like 8 years, we are into IVF now. We have a team of gynecologists, Ayurvedic doctors, modern medicine practitioners, and all the therapeutic advancements that we have in our clinic. So people who can actually have all the services under a roof, and natural way of conceiving is a priority for us. Natural way. Like everyone doesn't need to have a IVF session, every IVF cycle. Everyone is not eligible for it also. So most of the cases who report to us, they tell me, sir, I want to have an IVF, I want to have an IUI. We say no. Let's have a natural ways. Let's try natural ways of pregnancy. So that's what the society needs for now.